All right. Well, greetings and welcome everyone to the Caregiver Coalition of San Diego Caregiver webinar. My name is Matthew Parcasio. I'm the Caregiver Programs and Outreach Coordinator at Aging and Independence Services, a department of the County of San Diego Health and Human Services Agency. I'll be your host this afternoon on behalf of Caregiver Coalition of San Diego that represents the community efforts of a diverse group of agencies, both private, public, professional, nonprofit, and for-profit that serve families caring for their loved ones. Our collective mission is one of support, education, and advocacy. I'll be recording today's webinar for future viewing, so any past webinars can be found on our caregivercoalitionsd.org website. I'll be sure to put that in the chat. But thank you so much for joining today's webinar on a Friday afternoon. Today, we're so pleased to have Aurora Valdez de la Torre, who will talk about Medicare fraud and scam. So there'll be a brief time for question and answer at the end of the webinar. So if you have some questions, hold on to those. You can put them in the chat. Click on the message button and type your chat in the question in the chat box, and I'm sure I'll answer it for you at the very end. As I alluded, please mention, assure that put the mute button so that we can ensure the presentation goes smoothly without much background. So Aurora Valdez serves as community engagement coordinator for the nonprofit law firm Elder Law and Advocacy. In this role, she educates older adults, people living with disabilities, and their caregivers, their rights, benefits. Aurora is committed to making complex information clear, accessible, and empowering, and it's my pleasure to welcome Aurora.
Thank you so much, Matthew. It's really great to be here. I'm really excited to share this important information with everyone. I'm going to go ahead and share my screen. I have some slides. Some presentation slides. Let's see. Right. Okay. So today we're going to be talking about Medicare fraud and scams and protecting yourself in 2026. This is a really big issue that's going on in our communities, fraud and scam. It's really a heartbreaking thing that's happening. So I'm really glad that we're all here to speak about these issues. I'm going to go through the presentation, but I definitely want to hear from all of you as well. And what you've been seeing out in the community so we can kind of let each other know what's going on. And so here's our agenda. I'll give a brief introduction to what our nonprofit supports folks with. We'll talk a little bit about Medicare basics because our program helps a lot with Medicare, seniors, and people with disabilities with Medicare. We'll go over what original Medicare, Medicare Advantage, which are your options with Medicare. We'll go over some assistance programs that help people save money on Medicare and preventing fraud and abuse. So if you would like a copy of this presentation, please leave your email in the chat and I will send it to you. Also, make sure you write down all of your questions. Those are very important to us. All right, so a little bit about us at Elder Law and Advocacy. Elder Law and Advocacy is a nonprofit law firm. We have several free legal services for seniors and different projects. We have tenant and leasing enforcement rights project. We have a nursing home rights facility project, elder abuse, scam and fraud. There's definitely a lot of different programs. So if you ever need free legal services, we have so many caregivers who come to us needing support. So please, we're always happy to help folks. In terms of Medicare as well, we can help caregivers. So we have in particular the High Cap program at Elder Law and Advocacy. That is the Health Insurance Counseling and Advocacy Program, which is California's state health insurance program. So we offer free, unbiased, and confidential Medicare counseling, Medicare and Medi-Cal counseling. We always screen people for Medicare assistance programs to make sure that they're saving as much money as they can on their health care. We have legal support for Medicare appeals and billing issues. And we also have the long-term care insurance, LCCI counseling. Our program in particular works with San Diego and Imperial counties. However, there are high cap programs in every state. So if you know someone in another state who needs the support, or even in another county of California, there's definitely a high cap that can help them. Okay, so a little bit about Medicare basics. So the parts of Medicare and how to enroll. So who qualifies for Medicare? It's folks over the age of 65. There are some people under 65 who qualify for Medicare, and those would be people who are on Social Security disability for more than 2 years. And finally, people who have end-stage renal disease also qualify for Medicare. Um, the people who administer it are Social Security. They handle the initial enrollment. And the Centers for Medicare and Medicaid Services, they manage benefits and plan contracts. So what does Medicare cover? Medicare covers medically necessary services, whether those are inpatient in a hospital, or outpatient when Medicare beneficiaries are seeing their doctors. Medicare covers preventative care, and that's always free. And it also covers prescription drugs if they're included in your plan. So Medicare does not cover long-term care. It does not cover cosmetic surgery. It does not cover massage therapy. And not every provider takes Medicare. So that's important to find out which providers take Medicare. Foreign travel emergency is not covered by Medicare unless it's included in your plan. And that is the same with routine dental, vision, and hearing. It's unfortunately not covered unless it's included in your plan. These are the parts of Medicare. We'll go over them, but the next slide will have an image that kind of shows how they all work together, or how they all work separately, because they don't all work together. So Part A of Medicare covers hospitals, skilled nursing facilities, hospice, and home health. Part B, that covers doctors, outpatient care, tests, and durable medical equipment. So something like a wheelchair. Part C is more often known, or more often called Medicare Advantage, and that combines parts A, B, and usually D all in one plan. Part D are prescription drug plans, and Medicaps are optional, and they cover out-of-pocket costs in original Medicare. So Medicaps are supplemental coverage. So how do these parts all work together? These are folks' options with Medicare. You can either have original Medicare on the left or Medicare Advantage on the right. So with original Medicare, as you can see on the left, you would have to get Part A, Part B, a Part D prescription drug plan, and optional is the Medigap, which is supplemental coverage. It will cover whatever Part A and Part B do not cover. So that's original Medicare. That's one option. Your second option, if you're a Medicare beneficiary, is Medicare Advantage. Medicare Advantage plans, they combine Part A, Part B, and usually Part D all in one plan. Some folks like that. They call it a one-stop shop. It depends on the person. Everyone's health needs are so different, and it really just depends on what a person in particular needs. We have a lot of caregivers who come in for the people that they care for, whether that be their family members, their parents, or such. We often have caregivers come and talk through the options, because oftentimes caregivers are the ones who have to make these decisions, right? For the people that they're caring for. Especially now when everything's online, and it's very, very hard for older folks. So yes, we are always willing to help caregivers. Okay. So let's get into Medicare fraud and abuse. So what is Medicare fraud and abuse, and how can you protect yourself or someone that you're caregiving for? Medicare fraud and what is Medicare fraud? What's Medicare abuse? So fraud, this involves knowingly billing Medicare for Medicare fraud. We're speaking about in particular involves knowingly billing Medicare for services that were not performed, or unnecessary treatments or tests. also more costly services than those provided, and lastly, or kickbacks or false documentation. Abuse, Medicare abuse, that involves medical or business practices that lead to unnecessary costs, but may not be intentionally deceitful. So, let's look. Okay. So the scope of Medicare fraud and abuse, this is really, really upsetting information. And I know we all know that fraud and abuse is happening all the time, but maybe we're not familiar with the actual numbers. So Medicare loses over $60 billion annually due to fraud, errors, and abuse. Fraud and abuse increases the cost for all patients. So whether they are in Medicare or not, all of the money that's lost has to be made up in different ways, right? So that's when everyone's health costs are going up. This is a really big issue that's happening. In 2025, the Department of Justice Fraud and Investigations quoted that 324 defendants were charged, and there were $14.6 billion in fraudulent claims. There was Operation Gold Rush, and through this operation, they found that $10.6 billion there was $10.6 billion in fraud, false durable medical equipment claims. So these scams and frauds look like they're all so different, and it happens in so many different ways. And I'm sure you are all familiar with some scams and frauds, and you've come into contact with some of them. So we'll definitely go over some of the scams that we usually see, and I'll go over the ones that we have seen. But I would also really encourage everyone to share maybe at the end if they've heard of any scams or frauds going on that maybe we can all look out for. So the first one that I want to share with you is the fake new Medicare card calls or emails. So scammers will claim you need a replacement card and ask you for your Medicare number or Social Security number. One thing to know, Medicare will never call you and ask you for your Medicare number. That doesn't happen. Social Security doesn't either. So these are organizations where you would have to call, inquire yourself. So that's really important to know. And if you ever come in contact, I like to suggest that people who are maybe getting phone calls or emails and they seem kind of iffy, it's always great to ask a friend or a family member. It's definitely something that you should put into practice. The second one we want to share with you is genetic slash cancer testing scams. That's when fraudsters offer free check swabs or mailing kits so that they can bill Medicare for unnecessary labs. Next, we have robocalls offering quote unquote free medical equipment. So the callers, they promise back braces, wheelchairs, or other supplies so they can bill Medicare even if you don't need them. Phishing emails pretending to be CMS notices. So this example is emails pretend to be official Medicare notices with links that steal your login or financial information. And then last one we have here, internet slash tech support scams targeting seniors. So that's when scammers pose as computer support and gain access to your device and steal personal or financial information. Mhm. Yes, I think also important to know, and something I also have seen often is people getting messages from what they think is Microsoft, reaching out to them and saying that there's a technical issue and they need to gain access to the computer. You never want to, Microsoft will never do that. So definitely, if anyone is ever trying to gain access to your device, that should be questioned. And you should always reach out to family, friend, or maybe you live. Um, some folks live in senior residences and they have really great staff that can also help with this if they feel like they're coming into contact with some scam or fraud. Okay, we'll go over four more. So fake refund emails. That's when folks will get Medicare refund department emails saying that you are owed a refund so that they can get your financial details. Um, and, and hospice fraud, that's free in-home services that are offered, but then folks are later enrolled into hospice, which is end of life care, and without their consent. Um, so we can see how a lot of these, it's like they're reaching out, offering something. So that's really how it's such a heartbreaking thing that's happening in our communities. People, especially the most vulnerable, are being taken advantage of because they're being offered all of these great things, great services or refunds. Um, yeah, that's why I think it's really great that you're all here as caregivers getting this information so that you can look out for the person that you're caring for. Quote unquote flex card offers. That's when scammers offer offers of Medicare flex cards for groceries and other perks in exchange for your personal details. And then we have the fake social security emails or calls. That's when scammers tell you they need your personal details in order to process your annual social security increase. Again, social security will never call you and ask you for information. Recent example that I want to talk about is hospice fraud. Sorry, folks. I don't know if you can hear my dog barking. Let me know in the chat if that's a problem, please. Um, so a recent example of hospice fraud, we had California woman loses cancer prescription. California woman loses cancer prescription access after hospice scam enrollment. So a senior woman in California discovered that she was unknowingly signed up for hospice services after someone offered her and her neighbors cash and free insure shakes in exchange for joining a new Medicare program. Medicare then treated her as a hospice patient, which denied coverage for her necessary breast cancer medication. So because hospice benefits only cover terminal care, not curative treatments. And she only realized the scam when her prescription was refused at the pharmacy. It took significant effort to reverse the fraudulent hospice enrollment and restore her prescription access. So that's an example of hospice fraud that we've seen. Very fortunate, very sad. Again, these scammers are getting smarter by the day, and they are always offering things. So it's not, I also don't ever want folks to feel like they, it's a, being scammed is, it can be a very isolating experience, and it can also make you feel like denigrated. You can really beat yourself up about it in simple terms. And I, it, I just want to shed light on the fact that these scammers are very, very schemy. They're very smart, and they have so many ways of trying to trick people. I've been scammed myself. I feel like all of us have seen so many different examples of scam and fraud in our communities. So I just want to also say that I think it's also really important to humanize this unfortunate thing that's happening in our community. The one I got scammed because I got a text that said that I owed on the toll road, and I used to take the 125 sometimes to Otay, so it happens. Um, so recent example, offers of equipment and supplies. We'll talk about this one. So an 88-year-old woman struggles with scammers impersonating CVS Pharmacy and Medicare. So what happened was an 88-year-old Medicare beneficiary began receiving calls from a woman claiming to be from CVS, offering a leg brace, even though her doctor hadn't ordered such a device. At the same time, another caller representing themselves as Medicare offered a cancer detecting device. Alarmed and unsure whom to trust, she reached out for help from the Senior Medicare Patrol, SMP, and local advocacy groups who helped her identify the calls as fraud. Community support helped her spot the red flags and avoid being scammed. So we are always I'll talk about Senior Medicare Patrol in a second, but if you're getting these notices from what you think are your pharmacy or Medicare and you need a second opinion, other than maybe family and friends, you can definitely always call us at HiCap and make an appointment with one of our counselors. We can go over all of those notices and make sure that they're official. And we'll go into the Senior Medicare Patrol in just a second. So some tips on preventing scams and fraud. Let me check the time. Um, so you want to make sure you or the person that you're caregiving for is very, very careful with their Medicare card and their Medicare number. Only share it with trusted providers. I've heard of folks who actually only take copies of their cards or and then take those to the doctors. Their card actually never leaves the house. It definitely depends on the person, but you want to be very, very careful with those cards. When you're seeking information on Medicare, it's really important to use trusted sources. There's so much information on the internet. So make sure you're using Medicare.gov, or you could also call 1-800-Medicare. You want to avoid pressure tactics from scammers. They try to rush you to decide. Again, if you have someone on the phone who's trying to rush you to decide to do something, because that's the whole point. They try to make you very anxious and scared. It's always really great that you go and ask someone. Go check with a neighbor. Or yeah, just always ask someone.
You're really hard to listen to.
Can you not hear me? Okay. Let me know if okay, so you also want to ignore cold calls or uninvited visits from insurance agents and unknown callers. And I know a lot of folks practice that. You can also actually block unknown callers through your phone. That's an option. Um, and you want to check medical records for unauthorized charges. Always check your medical records or check the medical records of the person that you're caregiving for. And read the fine print on the mail, so the really small text to make sure that it looks official. Okay. So the Senior Medicare Patrol, they actually have a Medicare tracker mobile app that they created as a resource. And it helps track your health services. It helps compare records with your MSN or EOB. You can quickly report suspected fraud or errors as well on this app. It also offers educational resources, news, and tools to prevent Medicare fraud, errors, and abuse. So that's a good resource. I know insurance agents, brokers are always seeking out to enroll new people. So we want to make sure everyone's very safe. So here are some things that insurance agents can do and what they cannot do. And you can report if you know of a broker who has done any of these things that they're not allowed to do, you can actually report them. And I'll show you how to do that in just a second. So insurance agents, they can schedule appointments with new customers and follow up with existing customers. And but they cannot make unsolicited visits or calls or approach you in public. Insurance agents, they can provide educational materials about Medicare options. However, they cannot use misleading marketing materials or use government insignia or imply government endorsement. They can conduct marketing in allowed settings. They cannot conduct marketing at an educational event. They can provide snacks at marketing events. They cannot provide full meals at marketing events. So they cannot provide a full meal. They can offer gifts or incentives of less than $15 of value. They're not allowed to offer anything that's more than $15 of value. They can enroll customers into a plan. They cannot enroll someone without their explicit consent. So here is where you can actually report fraud. We have 3 places where you can report fraud. You can call Medicare and say report fraud when prompted. Here's a phone number for that. Or we also have a website. You can call Senior Medicare Patrol to discuss fraud concerns with an advocate. And you can also call the Department of Insurance to report agent broker malpractice. Here are some low-income assistance programs. These are the ones that we always screen folks for. So if you have any questions on these, please let me know. We want to make sure everyone's getting as much savings on their health care. So please, if you know of yourself or know anyone else who needs support, please give us a call and make an appointment. We're always available with counselors. Yeah, that's about it. I will look at the chat to see if there's any questions, but also if you have any scams or frauds that you've seen recently and want to share, please do.
Aurora, thank you so much for that very informative presentation. I certainly learned a lot of potential scam to be aware of regarding Medicare. I never knew some of those would be at the forefront. So thank you so much. Yes, does anybody have any questions, or as Aurora mentioned, any fraud, any specific, maybe not related to Medicare, that they just found out about or knew of?
I know.
I'm,
Oh,
go ahead.
oh, sorry.
Yeah.
Go ahead. No, go ahead.
Yeah, one of the recent types of scam that I heard of was the title scam, or people putting claims on or removing the actual homeowner from the home and selling their home and changing the title on the owner. So if you are a homeowner, you can actually go to the assessors, county assessors, and sign up for a title alert system where it'll notify you if there's someone trying to, or any activity on your title of your home. So yes, please sign up for that. It's free. You can get email alert notifications if there's any activity having to do with the title of your home that you own.
That's great. Thank you, Matthew. I actually hadn't heard of that. That's really, really sad. One I'm familiar with is the love scam. So people trying to trick folks into falling in love with them, and then they send them a lot of money. That's one that I've heard a lot, and that one's very, very upsetting. Also, there's so much AI that's being used now, whether that's images or even voice like the AI can copy someone's voice. And yeah, I don't know if any of you have heard of any scams regarding AI.
Jackie in the chat asked, how do we sign up for the title alert? Yes, actually, if you want to stay on for a little bit after we officially conclude the meeting, we're happy to share that information. I actually have it. I had the card that us county staff were distributing. I can put the link in the chat. So if you want to stay on for a little bit, I'm happy to do that. Anybody else have any questions? We have about a minute left for Aurora.
Is there less scam problem when people are in a HMO or, this medical type thing than versus straight Medicare?
That's a good question. I don't think there's a difference. I haven't heard, if there is one, I haven't heard it. I think both, either way, folks are getting scammed. But that's a good question. And I can look into it more. Was that Dorothy?
Yeah, it's just that, when you belong to Kaiser or Sharp or whatever station you're in for your health care, UCSD, Scripps, usually they'll, if they have a Medicare Advantage program, you apply for Medicare, straight Medicare. So I just was curious. I have not been the recipient of Medicare scams. So I was just curious if, because I don't have straight Medicare, if that's one of the reasons. But anyway, it was just a thought.
Yeah, no, that's a good question, because there's two different options. But I don't think one is safer than the other per se.
Okay.
Yeah. Thank you, Dorothy.
All right. Before we go, I just want to let everybody know I did put the San Diego County Assessor's Office link to the owner alert, and you can follow that link, and it should lead you to our county assessor's office and how to sign up.
Thank you so much, everyone.
All right. Yes. Thank you. And thank you, Aurora, for the
Yes, of
presentation.
course.
So we appreciate everyone joining us this afternoon for the San Diego Caregiver Coalition webinar. Visit us at caregivercoalitionsd.org, and we hope to see you next month at next month's webinar. So long and have a nice weekend.
Bye, folks.
SDA or CC.